I want to tighten my skin, jowls, and most of all to improve wrinkles and sagging in my cheeks. What's the best procedure? Do I get a CO2 laser peel? A mini facelift? If I need both, which do you try first?
Thank you for your question. You've submitted several photos and it's very, very helpful. And you're asking the question that you want to improve the sagging skin, the jowls, the wrinkles, and you're debating whether or not laser versus a mini lift would be of value to you. Well, just to give you a little bit about my background, I'm a board-certified cosmetic surgeon practicing in Manhattan and Long Island for over 20 years. I have background specialty training in oculofacial plastic and reconstructive surgery. So I can tell you that cosmetic approach to facial aging is something that's been at the center of my career for over 20 years. So you're asking basically about two separate issues. When you talk about wrinkles, you're talking about skin quality. When you talk about sagging, you're talking about descent. And I wrote a book several years ago about facial aging and about looking natural. And I can tell you that it is very important for you to really zone in on what your priorities are. But I would suspect they're all a priority because they're all interrelated. So for the jowls and for sagging skin, you're basically you're going to have to do some kind of face lifting procedure. There was a time, this is going back 20 years, when the CO2 laser first came out, that the buzz was that CO2 laser would eliminate the need for facelifts. And that was pretty absurd because CO2 laser can tighten skin, but nothing can tighten skin enough to lift sagging jowls and cheeks. Move the clock forward 20 years later, and the same false claims are being made by all kinds of thermal energy devices that create allegedly surgical results. But as one can observe by the many disgruntled patients who have had these thermal energy devices, it's not working and it's not turning out to be the case. The pillars of facial structure have to do with the underlying structure of the skin called the SMAS, or superficial musculoaponeurotic system, the skin itself, and of course the tissue quality. As we get older, we lose bone, muscle, and fat. And so there is everything has to be done in a measured way to try to optimize your look for your stage of life. No one's going to mistake a well-lifted, volume-enhanced 70-year-old for a 30-year-old. It's just not going to happen. But you will look good for your age zone. And I refer to it as the indeterminate age. So I would say that most likely you would benefit from some type of lifting procedure, and you can have CO2 laser or other thermal-based treatments at the same time to help overlap the treatment so that you can overlap the recovery period. But I think that given the relative depths of the lines that you've illustrated through your photos, I think that the combination approach will be of value. Now, this is in the absence of a physical examination, and it's so critically important to be able to examine and feel the skin quality, the texture, and have a dialogue in order to really come to a more definitive plan. So I recommend you meet with qualified, experienced cosmetic surgeons who have a lot of experience in facial aging procedures and get a sense of their style and the way they do things. In our practice, we do our procedures in our own facility, in our office, under local anesthesia with very light sedation. So recovery is definitely enhanced in that way, and we've become well known for that. And so this is these are little things that are meaningful to patients when they're making decisions about surgery. So desired outcome, the style, the surgeon's style, and what they consider aesthetic. There are people who prefer an exaggerated aesthetic, and those are not, they don't overlap with my aesthetic style. So I prefer a more natural aesthetic. And then the way I do surgery in a way so that my patients heal faster and recover faster. And that's where the local anesthesia, light sedation has this been tremendously of value to our patients. So again, meet with a doctor that resonates with you, and I think that you will be pleased to see a result once you've begun this journey. So I hope that was helpful. I wish you the best of luck, and thank you for your question.